Our next speaker is Dr. Julie Fields. Dr. Fields is a neuropsychologist at our Rochester campus, and she's going to talk with us about mild cognitive impairment and dementia. Dr. Fields.
Good morning. So as he said, I will be talking about mild cognitive impairment and dementia, and in particular how it pertains to medical settings. No disclosures. What I hope to achieve with this talk is to help you understand better the differences between normal cognitive aging and mild cognitive impairment and dementia. I will give you some tips on when to make a referral for further cognitive testing. I'll also talk about the implications of making diagnoses such as MCI and dementia. And then I'm going to discuss some intervention strategies as well as talk about the benefits of some of those strategies. So we all experience changes as we age cognitively. Those tend to be things like slowed mental processing. We're not as quick to come up with things or to track information. It's a little more effort to make decisions. We have a little bit more difficulty multitasking, paying attention to more than one conversation at a time. And we become more rigid in how we think about things, less amenable to change. We also have occasional forgetfulness. One of the most common things that people come into the office with complaints of is forgetting people's names, also why they've gone into a room. What we typically see is that people can generally remember sort of the gist of things, but they just may forget some of the specific details. However, it's not normal aging anymore when that forgetfulness, so for things such as appointments, things that they've said or done in the past, repeating oneself over and over, when this gets to be beyond what you would expect for their age and education and background, then there needs to be some concern that there may be something more sinister going on. The concept of mild cognitive impairment was introduced by Dr. Peterson in about 1997 and his colleagues at the Mayo Clinic. And originally, it was conceptualized just to include the domain of memory. However, over the years, we've learned that it does, in fact, involve more than memory, and so that concept has expanded to include other cognitive domains, such as language, executive functioning, perceptual processing, and so on. But we would call a person, we would diagnose a person with mild cognitive impairment if they had a cognitive complaint. Again, typically, most often it's memory, but often it's other things, language, executive functioning. And if that cognitive decline is beyond what would be expected for normal aging and compared to their previous level of functioning. So there has to be a measurable decline.